This is Matt with Mobility 101, and right now we're going to go over some common knee issues you see in powerlifters and Olympic lifters, and kind of ways to troubleshoot them and kind of problem solve, right? So with the knee, you have to understand that it's two joints, right? So when we look at the knee in terms of troubleshooting, trying to figure out how to solve the problems with nagging, joint space pain or tracking pain, or looking if it's a soft tissue related item, right? So if it's tracking, right, so that's the patella, the kneecap, not tracking properly at, when you go into your squat or any sort of squatting pattern, whether it's overhead patterns or what may have you. The other thing we could look at is there enough joint space for it to be able to move freely while it's tracking, right? And the other piece we have to look at is the surrounding musculature, the soft tissue areas, the musculoskeletal areas. Are they kind of hindering its progress, so to speak? So, look at all the attachment points of the IT band, quadriceps, and all the muscles below as well. So these kind of ways just to troubleshoot in terms of problem solving, how to fix the solution rather than just, kind of blindly going after the problem, right? So the first one we're going to look at is cleaning up some joint space and getting some more space in that kneecap, that patella, so it can move freely during tracking. So all I have here is just a rolled up towel and taped up. So the goal here, what you're going to want to do is, want to take that towel and put it directly behind the knee right there. And once you're there, you want to clamp down nice and tight while it's in there. And then the goal is, by having this towel in there, what you're going to gain access to is just a little bit more joint space above and below the patella, so above and below that kneecap. And all you're going to want to do is just sit back, shift your weight back, and if it's enough pressure here, cool, no problem, just hang out. If it's not enough pressure here and you want to add some more, it's not a bad idea to kind of just sway side to side, just to add that little more overpressure there. I wouldn't recommend staying here more than about 30 to 60 seconds. The other important thing to note is you want to test your body weight squat before doing this and also retest it afterwards, okay? And give an idea to how that feels before and after, and if that kneecap is able to move more freely by gaining more joint space by doing this drill, okay? So the next one we're going to do is something to get better tracking. So what happens is a lot of overuse, overdoing it, that patella isn't allowed to track properly, in addition to not having enough joint space. So we clean up joint space. I'm going to clean up tracking issues. So what we're going to do here is just get a stool. If the stool is too high and it's too aggressive of a mobility piece to do, not a problem, just don't use a stool. But if you're able to use a stool, go right ahead. It's roughly about 6 to 8 inches. What you're going to want to do is set yourself up with your foot on top of the stool. Okay? You're going to take your hands and you're going to add compression around the tibia, and in doing so, you want to internally rotate the tibia. Okay? So it's, again, you're adding compression and then internal rotation of the tibia. Once you're there, the goal is to essentially just drive forward. Now, we're not driving forward for the purpose of getting as much knee flexion as possible. That's not the goal. Yes, we want some knee flexion, but the goal really is the compression and the internal rotation of the tibia that's going to allow that kneecap to track more properly, okay? So again, add compression right under the patella. You're going to internally rotate and then get some knee flexion and then back off. And again, compress, internally rotate, knee flexion, and back off. Making sure that you're grabbing with enough pressure to internally rotate. This is something where you want to grab. We don't want to be too soft with this. We really want to get in there and grab. Okay, so again, compression, internally rotate, and add knee flexion. Now, if this is not enough, simply stand up while you're doing it, okay? So you have that overpressure. You have the ability to get more pressure from that back foot leaning into it, okay? So again, internal rotation, compression, lean forward, and come back. And again, and the goal is trying to get that knee over the middle toe on the foot. Keeping this heel flat. Good. So once we cleaned up tracking and joint space in the patella, we're going to look at kind of cleaning up what I think to be is one of the main factors in not allowing this kneecap to move properly, so some of the musculoskeletal soft tissue areas. So what we want to look at with important note is the VMO. So right on that teardrop on the medial aspect of the kneecap, I want to think, yes, we all foam roll, we add soft tissue devices, and these are all great items, but I think adding some pin and drag type of mobility drills in terms of soft tissue will help a ton. So I think what we want to do is we want to pin that lacrosse ball down to the ground like this. So once I'm there, I'm adding pressure into the lacrosse ball into the ground, and I'm laying there, just kind of letting it smoothen out that VMO, that medial quad right there. And from there, if I can tolerate, all I'm going to do is keep that pressure on, and then add some slow and controlled knee flexion. Okay, and by all means, feel free to move up the chain in terms of closer into the groin, the adductor region. Slowly and controlled is the kind of the name of the game here. And again, I'm just adding some overpressure down while just adding some gentle, slow and controlled knee flexion. And then once it's kind of loosened up and released some of that tension, feel free to roll it out a bit, just some little circles and oscillations in that area. Angling the medial aspect as well as the anterior aspect as well. So the big thing to do, to keep an eye on, is that you want to test before all of these items, just your regular basic bodyweight squat, and you want to retest at the end of each one and also at the end total, just to see how it feels, how that knee tracks before and after. All right, so give those a shot. I hope they help. Thanks.